Hello, everyone. Thank you for joining us today at our virtual reality Naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CADCA's National Leadership Forum. We then engaged with many of our amazing community coalitions to learn how they can host events using this technology. We had tremendous initial feedback, including how to use this VR as a standalone awareness event, create a training around it, or add it to trainings that are already being held. To date, we've had more than 20 virtual screening events. We've engaged thousands of participants, and we look forward to hosting more events in the coming years and engaging 1,000 new participants. Today, we are grateful for you, our amazing CADCA members and guests, and we are specifically thankful to today's co-hosts, Gloria, Marfo, and Coma, Chief Aaron Lipsky, and the amazing team at Rise Drug-Free Milwaukee, formerly MixApp. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we'll hear from a wonderful group of speakers here in Milwaukee who are working every day to save lives. We are honored for them to be part of this event. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. From these events, we plan to learn how we can use this technology to better save lives and ultimately create a norm that every life is worth saving. Now, I'm pleased to introduce our first speaker, CADCA's Chief of Staff, Valentino Murphy. Valentino joined our team in 2021 and has been working ever since to help further CADCA's mission of building and maintaining safe and healthy drug-free communities. We're thrilled to have him with us here at CADCA, and we appreciate him being here to speak with us today. Valentino?
Thank you, Reiko. It's such a pleasure to be here for this important event. Before we begin, I want to personally thank Walmart for their investment in this technology and the people who will benefit from this life-saving training. I'd also like to extend a special thanks to our friends and supporters and community advocates and today's co-host, Rise Drug-Free MKE. It's an honor to be on with such impressive leaders from the great state of Wisconsin. Finally, I want to thank everyone on today's webinar. We hope this unique event will prepare you on how local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide. We have more than 5,000 coalitions across the United States. We have sought to train community residents and leaders to build and develop coalitions in their communities and reduce substance misuse by adapting CADCA's model for community change. CADCA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. Prevention has become more important than ever. Recently, the CDC reported that over 109,000 drug overdose deaths occurred in the United States in the 12 months ending March 2022. This is the largest number for a 12-month period ever recorded. To put it in perspective, that number would fill American Family Field twice over. This is tragic, and we have to do our level best to right this ship. Together we are stronger, and as we train substance use and misuse prevention to coalitions every day of the year, all across the world, we know that without the buy-in of leaders and community stakeholders such as yourselves, our desired end state will prove unachievable. You are the true heroes in your community. The conversations being held today on this webinar is not unique. Our partners at the Drug Enforcement Administration recently launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. During CADCA's 2023 National Leadership Forum, DEA Administrator Ann Milgram stated, "This is not a war on drugs, but a fight to save lives." Let it be known, if you do not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. I want to encourage you to keep up the great work you're doing. I look forward to seeing you in person the next time we're all together. Thank you for having me on today. Now back to you, Reiko.
Thank you for those remarks, Valentino. We appreciate you joining us. And now it is my pleasure to introduce our first speaker. We are excited to introduce you to Gloria Marfo Ancoma. Gloria began her career in public health in Baltimore, where she focused on violence prevention and substance use intervention. Most recently, she served as program coordinator of the Supporting Male Survivors of Violence. This is a grant at the Baltimore City Health Department. In that capacity, she facilitated community events, including weekly self-community conversations with young men of color and their families, and the Summer Youth Engagement Program for young men. Gloria also served as trauma programs intern in Baltimore's Office of Violence Prevention, and as a substance use programming and educational resources peer educator at the University of Maryland Health Center. She earned her Bachelor of Science in Community Health and Special Populations from the University of Maryland. She and her husband currently serve as the youth leaders in their local church, and in her spare time, you can find Gloria admiring the natural beauty that this world has to offer. We turn it to you, Gloria.
Good afternoon, everyone. My name is Gloria Marfo Ancoma, and I am the Mental Health and Wellness Coordinator with Rise Drug Free Milwaukee. I also co-coordinate this coalition with Mr. Ismail Luna, so I just want to make sure that I also shout him out this afternoon. I want to thank you all so much for the opportunity that you have given us to come into your space right now, just to talk a little bit about the work that we do as it relates to overdose prevention. So one of the things that I just want to cover so that there's no confusion is that, yes, today we are called Rise Drug Free Milwaukee, but in years past, we have been called the Milwaukee County Substance Abuse Prevention Coalition, where RISE stands for Resources for Inclusive Substance Education. Resources for Inclusive Substance Education. And so with that in mind, I also want to talk a little bit about how we provide these inclusive resources. And one of the things that we do is we are a coalition, right? And so with that alone, we have reached into so many different sectors of life. And part of those sectors will be represented later on in our call today. I'm just kind of prefacing for everyone, but you will get to hear a little bit about the power of a coalition. It's not just one organization, it is many. And so because of that, we're able to reach into a lot of different aspects and facets of life, right? And so one of the things that I just want to speak about that we do as a coalition and through these partnerships is that we work with Hyatt pharmacies across Milwaukee County to make sure that we provide them with medication lock boxes, as well as drug deactivation kits and deterra bags, so that as they are passing out their prescriptions, they are also passing out these tools to prevent overdose. In addition to that, we meet during the fall season. We do meet at a lot of the different high schools to go through the Friday Night Rivals events. We have parents, we have grandparents, we have children, we have grandchildren, all coming together. And we speak at these events to talk to them about how to safely dispose of drugs after they've used them. And in this case, we're mainly focusing on the parents and the grandparents, but in some cases, youth also have prescriptions that they're given due to, athletic injuries and things like that. And we want to make sure that they are able to, deactivate the drugs and trash them so that no one else can get into them. We also speak to them about how to use the medication lock boxes. We also provide brochures and materials on how to speak with youth and young adults about drugs and drug usage. So we really try to be well-rounded in our approach to, communicating with both the older adults and the younger adults surrounding drug usage. In addition to that, we try to be really intentional about teaching the community and empowering the community through education. And so we work with the Community Advocates Public Policy Institute to put out a series of free trainings to all community members. So we have the Question, Persuade, Refer suicide prevention training, where we talk about the different signs and symptoms to be on the lookout for if somebody in your life may be contemplating taking their lives. In addition to that, we try to have a special emphasis, especially on folks who may be using substances, just so that we are able to intervene in an appropriate manner. We also do adult and youth mental health first aid classes where we actually talk about the different signs of adolescent development, the different signs of, even adult development, and what the onset of disorders might look like so that we can intervene. During those trainings, we do talk about substance use disorders. We talk about naloxone and how to administer it. We even talk about where you can find naloxone and Narcan in the Milwaukee County area. We have a series of other trainings, and if you're interested, I invite you to go to the Community Advocates Public Policy Institute website so that you can take advantage of those free trainings and bring a friend or two so that as a community, we will learn this information and be able to prevent these overdose deaths. In addition to that, we do an event called Overdose Awareness Day, where we partner with a lot of the folks that you're going to see in the next few minutes to put faces behind the statistics. We hear a lot about the number of deaths that are coming as a result of opioid overdoses here in Milwaukee County, and numbers are powerful, but a lot of times people seem to forget that they also represent lives. We know that any death that occurs, at least 10 people are impacted by that. And so during this Overdose Awareness Day event, we really try to put, some humanity behind the numbers and let the folks know, the impact of these opioid overdose deaths in the community. And then also empower them, as it relates to their mental health and wellness. We have counselors on site. As it relates to, actually preventing these deaths, we have folks who are able to do the naloxone trainings, the Narcan trainings, and actually pass them out during the event, and a series of other providers that come out just to support. And then I think the last thing that I will touch on is our signature event, which is the Light and Unite Red Week. Light and Unite Red Week, we do every year in conjunction with National Drug Facts Awareness Week. And the whole point of that, week-long program is to really provide maximum opportunity for the community to really look at that relationship between substance use prevention and mental health promotion. This year is going to be taking place from March 20th to the 26th, and I invite you all to go to risedrugfreemke.org to go and sign up to come and join us at some of these events. You can bring your children, you can bring your grandchildren, you can bring your significant other. It is open to the entire community, and they are all free of charge. Please do take advantage of this so that you will be able to, increase your ability to make a difference in the opioid deaths that we are experiencing here in Milwaukee. I want to thank you all so much for your time this afternoon. It's really not easy to, carve out an hour of your life, but I'm very grateful. And I think I can say that all of us who are on the call today are very grateful just that you've come, that you're here to listen, and not just listen, but then also do apply and work with the community to try to resolve and prevent a lot of these opioid overdose deaths. So again, I thank you so much. Continue to do the good work that you do, and let's partner together to see how we can support our community moving forward. Thank you. All the best.
Thank you, Gloria. Your work is so important in offering a range of trainings for those who want to make a difference in Milwaukee. And thank you for helping to make today's webinar possible. Next, I'd like to introduce you to Milwaukee Fire Department Chief Aaron Lipsky, who also serves as the chair of Rise Drug Free Milwaukee. Fire Chief Lipsky has served the city of Milwaukee for 26 years. Joining the Milwaukee Fire Department in 1997, he's a fourth-generation Milwaukee firefighter. Prior to joining, he served for several years as an EMT with an urban private ambulance service. Chief Lipsky holds a bachelor's degree in communications, minoring in Africology, and a master's degree in public administration, both from the University of Wisconsin. Lipsky has filled every rank, rising from firefighter to heavy equipment operator, then onto the company officer positions. Appointed to battalion chief in 2010, Lipsky initiated a series of exercises with all neighboring fire departments, with whom there had been very little interaction and frosty relationships for decades. As a deputy chief, this evolved into a positive and productive shared services initiative, which now has a team of true partners along all jurisdictions throughout Milwaukee County. This initiative has been a shift in the provision of fire and EMS services for all involved. In 2019, Lipsky was promoted to assistant chief overseeing the department's support bureau, responsible for all budget and financial concerns, dealing with elected officials and the Fire and Police Commission, labor relations, investigations and disciplines, all technical services and dispatch, as well as fleet and facilities. In late 2020, Lipsky was approved to be the acting fire chief for the Milwaukee Fire Department. He was sworn in as the fire chief in June of 2021. Chief Lipsky also trains fire departments and tunnel and mine contractors nationwide to field mine safety and health administration compliant rescue teams. Additionally, he has been a fire instructor for the Waukesha County Technical College Protective Services Program for 8 years. Lipsky is the past chair of the American Lung Association's local leadership board in Wisconsin, as well as current chair of the RISE Drug-Free Milwaukee. He sits on the board of directors for the American Red Cross of Southeast Wisconsin and is the second vice president of the Wisconsin State Fire Chiefs Association and the vice president of the Milwaukee County Fire Chiefs Association. Chief, thank you so much for joining us today. We're excited to hear from you.
I'm Aaron Lipsky. I'm the fire chief of the City of Milwaukee Fire Department, and I've been on the Milwaukee Fire Department for 26 years. I worked in a private ambulance company doing emergency medical services here in Milwaukee for a few years before that, and had a ton of exposure in my role as a firefighter and EMT in responding to emergency medical calls, and just far too many of them related to drug overdoses, other sorts of impacts related to drug misuse. And of late, as I have climbed in my ranks in the fire department, it just seems as if the problem has just exploded. The opioid epidemic, all of the inputs causing that. We are collectively, it's a little bit like wrestling with smoke. We are collectively all taking swings at it, and we're only landing a few of those swings to try to push back against this problem, but we are starting to make some dents, and that's much better than what had been going on. That's my day job. And then I've also been quite involved with community advocates, and specifically in the Milwaukee County Substance Abuse Prevention Coalition, MCSAP for short. And that we are in the middle of rebranding. That's going to be RISE Drug-Free MKE. I've been the chair of that board for just under 4 years now, and involved for many years before that. And that is an absolutely incredible coalition of public, private, NGOs, healthcare system, fire, some law enforcement, EMS, grassroots organizations, and it crosses jurisdictions, even though it says Milwaukee County, and that's really what's funded. There's a ton of information sharing around the region, the state, and also across the nation. This group I have found to be extremely, extremely adept at getting to folks that are actually either suffering from this or who are attempting to solve some of these issues. And in a real way, it is an intentionally and a successfully diverse group of people with a common goal. It seems as if nothing can stop us. For the fire department's part, we started up the Milwaukee Opioid Response Initiative, and this was based very closely on the model of our community paramedicine mobile integrated health program, which really functions as more of a caseworker, social worker role than an emergency responder. What we have found all through the pandemic, all through the civil unrest and many other problems, even in those challenged, angst-ridden times, people still have a lot of very, very real trust in their fire and EMS services. We decided to leverage that to kind of get past the entry point. And so because people will open their doors for firefighters, we thought, well, let's at least get in the door and see if we can't actually provide some help. To that end, we began the mobile integrated health program and began doing environmental scans and connecting people up with primary care physicians and sorting out pharmaceuticals and obtaining medications and discussing things on a more human level. And we're able to take those high utilizers and turn them into non-utilizers or regular utilizers, because we're actually giving them avenues to handle little problems for themselves before they turned into big problems. We used a very similar model then with the MORI program, Milwaukee Opioid Response Initiative. As soon as we get a 911 call for an overdose, individuals in the MORI program are notified. And a MORI car is staffed typically with one EMT, one paramedic, and one peer counselor. And a peer counselor is a person who is living in recovery and who has sought out additional education and training, but arrives with that life experience. So the way we look at it is the firefighter will get the program in the door, and the peer counselor allows us to stay. The whole point of that program on the very front end is post-overdose or post-resuscitation. As soon as we can physically make contact, we make contact, and we are really asking simple questions. Are you ready? Are you ready to try to kick this? Are you ready to get some help? And if they are, we have arrangements, all squared away. We can get them right to medically assisted treatment, counseling, therapy, whatever they're going to specifically need, we can make that happen. And I would like to tell you that we have some extremely high percentage of success rate with this. We do not, but we are having success. It's, we're our own worst critics. So I'm not going to sit and say, oh, it's just amazing, we're saving everybody. We're not, because the grip is strong. But we are having some very real successes, and proud of that. And we're going to continue pushing and pushing and pushing. We pushed out nasal Narcan out to our basic life support, our BLS companies, a number of years back. And that used to only be an ALS or paramedic skill. So now we have it on all of our frontline companies, and we have available in concert with one of our medically assisted treatment centers, CMS, Community Medical Services, Hope Kits. And the Hope Kit contains Narcan. It contains a mouth mask barrier for providing respiration for somebody who is having trouble breathing. It includes fentanyl test strips, which were recently legalized in the state of Wisconsin. And because we know that there's a lot of mixing going on, there's a lot of, and there's a lot of things that they're moving faster than we are, but we're trying to catch up. And then there's resource cards. So the main point is to keep a person alive, which is an extremely low watermark to try to achieve, but it is the watermark. That's where we are. That's how dire the situation is. And so people can come up to any fire engine, any ladder truck, any paramedic unit that can ring any firehouse door. And all they got to say is, hey, can I get Narcan or can I get one of those kits? And we just hand it off. We don't record any data. No questions asked. The idea is to basically flood environments with this so that if somebody overdoses and is dying, people nearby can administer that quickly, immediately. They're, people in close proximity. We are working our tails off to try to keep this thing going. Of course, we're not unique in the city of Milwaukee, but we're all doing this against, austere and shrinking budgets. We've had outstanding assistance with some NACHO grants that we've had specifically for the MORI program. And can't thank the good folks at NACHO for approving those and allowing us to continue our work in this way. We also know that this work is not done in a silo. So this program is by no means just the fire departments. We do the lion's share of the work, the logistics, we kind of built it, but we have excellent partnerships with the Milwaukee Health Department, the Medical College of Wisconsin, our medical direction at Milwaukee County Office of Emergency Management, EMS, healthcare partners, community medical services, and other medically assisted treatment facilities, the peer supporters. It's an impressive coalition of people who are all dedicated to the exact same mission. We also understand, as part of our work, much in the same way that a fire department will give fire safety talks to children or adults. We'll push smoke alarms on people if they don't have them. Make sure you get one put up in your house. We'll help people kind of evaluate their homes to see if there's any fire safety issues. We'll talk through escape routes. And that's all in the name of prevention. We do so much emergency medical service work now that it would be impossible for us to not be doing prevention work in in the healthcare arena and look ourselves in the mirror. So community paramedicine program and the Maury program certainly is engaged in any way that we can. It could be as simple as tabling at block parties or community events and just reminding people there are resources. One of the things that firefighters have typically always been good at, and I think it is a reason people trust us, is we seem to be okay at not stigmatizing people when they're suffering from something, because that's 99% of what we see are people in horrible situations, suffering, many times embarrassing situations, criminal or legal situation, and we're there handling the medical end of things. And our folks are really good at not, making that a thing, but simply just providing care, using our skill and our tools and our techniques and the equipment we have, and just try to make it better. And I think people can sense that. We can start to utilize that much in the same way as we did with the community paramedicine program. We can utilize that goodwill and that trust to dig deeper, to get more ingrained in the communities around us. We are having regular community meetings in our fire stations. We have about 4 a month. We jump around to different fire stations around the city. We'll bring in other folks from RISE MKE. We'll bring in folks from CMS, our Maury program, and other community support services, and just bring people together in a fire station. We're finding that people really, really like coming to a fire station. It's an easy spot to go to just by proximity for most folks. And they feel comfortable there. They know, we're not going to be badgering them about anything. We're opening our doors. And if we can leverage that to try to get some good information out, I think we can start to turn the tide on this thing. But we're not near that yet. That's feels like that's a very long way down the road. I would really like to thank everybody for jumping on and viewing this webinar. I hope that you learned a little bit something about what we're doing here in City of Milwaukee with the Milwaukee Fire Department, our Maury program, and the outstanding folks at RISE Drug Free MKE. We're proud to be doing this work, and it's good to know there's others out there such as yourselves who are leaning forward with us. So thank you so much.
Thank you, Chief Lipsky. I know in so many of our communities, fire departments fill a crucial role in connecting community services. We appreciate the bold leadership that goes into implementing these programs. We are thankful for all of you do in the community and with the coalition and throughout the department. Next, we turn to Tamika Glenn, the community coordinator with the 53206 Drug-Free Communities Project. Tamika has over 25 years of experience working with children, teenagers, and young adults in the 53206 zip code through her service with Wisconsin Community Services, COA Youth and Family Centers, and the Boys and Girls Clubs of Greater Milwaukee. She also served as the inner city lead and asthma specialist for the City of Milwaukee Health Department, as well as at the Children's Hospital in conjunction with the Dominican Center for Women. Her work in environmental public health was highlighted in a 2008 special on PBS, showing how she spearheaded efforts to respond to unsafe lead levels affecting 39,000 children. Tamika is a youth and men's basketball coach at all levels and founded the organization Glow Up Milwaukee, mentoring more than 160 transitional age young men, helping them build confidence and self-worth and encouraging them to glow, that God leads our worth. Tamika, please take it away.
Hello, my name is Tamika Glenn. I am the DFC for 53206. I am the communities coordinator for Milwaukee, Wisconsin. I was a part of this neighborhood in 53206, born and raised within this neighborhood. But I remember growing up, I never had a communities coordinator to teach me much. And one of the things that I was addicted to was marijuana and alcohol. Because growing up in the household that I grew up in, we were exposed to a lot of drug use and alcohols and domestic violence and all types of violence. And that's what made me want to actually become a community coordinator, for drug prevention in 53206 because I never had an outlet or no one to talk to about none of the issues and things that I was going through as a young lady. Growing up around a lot of drug abuse and alcoholism, I was a victim of rape and abuse within my household and in my neighborhood. Because of the alcoholism and the drug abuse, my brothers were in and out of prison system a lot. So I basically had to raise myself. And I've always said to myself, I know a lot of these kids out here wish they had someone like me to be able to talk to, so which in turns make me more relatable to be able to fulfill this role as a community coordinator for the drug-free community. We show them that it's not just the drug use that you have to think about. You have to think about your life skills, your generation, your reproduction. It's so many different moving parts that go along with this that a lot of our youth do not even think about. I really believe a lot of this fentanyl use, drug use, and alcohol use is hand in hand with some of the other issues that are going on within our 53206 zip code here in Milwaukee, Wisconsin. Like as far as the reckless driving, the domestic violence issues, majority of the times, 9 times out of 10, the kids are either under the influence of something, or even when there are domestic violence issues going on, a lot of the times the couples are drinking together, using drugs together, and it riles them up and it makes them really get to the point where they're fighting against each other and arguing so much. And then the kids are being involved. A lot of people don't think about a lot of those things being linked to each other. And as my job as the DFC for the 53206 zip code is to show people the linkage between the violence and the drug use that's going on in our streets and with our youth. And now we can't just say it's a youth thing. This is actually a community thing. So I just want to bring awareness as far as a person that's boots to the ground out here walking these streets every day, talking and canvassing neighborhoods to whomever want to listen or whoever wants to be involved. We are pushing here in the 53206 zip code for more Narcan training, more testing strips for fentanyl, vending machines and local agencies and other organizations that people have more access to. In the 532 zip code, we do not have much as far as mental health placement for people. We are pushing to have more outlets for people to be able to come and discuss their mental health issues, because if you don't discuss these things, how are you going to be able to teach anyone prevention or even show them how to prevent themselves from being addicted to these different drugs? And I just hope everyone out there is really paying attention and listening to what's going on here in Milwaukee, Wisconsin, because right now we are at dire straits here in Milwaukee. And I just want the Rise MKE Coalition to keep pushing and keep bringing awareness to what's going on, showing the linkages between the two. If we can curb a lot of these mental health issues, I really do believe that we will be able to curb some of the drug use issues that's going on out here in these streets, because people are only numbing their feelings from the pain and the hurt and the grief that they're going through right now. So with Rise MKE, I just hope that we still stay strong here at MKE and we keep making the improvements that we are making. And I just want to thank you all for listening, and you all have a wonderful day.
Thank you, Tamika. It's inspiring to hear the healing you're able to bring to your community, and it shows us that this work truly has no borders. Thank you for being that bridge builder that we all deserve for so many youth and young adults. I'm now so pleased to introduce Abby Gurecki and Lindsay Foose from the Greenfield Health Department. Abby and Lindsay will share with us about the latest activities of the Health Department, the establishment of Safe Greenfield, a local substance misuse, mental health, and wellness resource guide for the city of Greenfield and the surrounding communities. They're truly carrying out the department's vision to create a place where all people can enjoy the best health possible and live, grow, and prosper in a healthy and safe environment. Abby received her Master of Public Health degree from the Medical College of Wisconsin and her Bachelor of Arts degree from Mount Mary University. With 8 years of experience in local government, Abby currently serves as the interim health officer and director and has solidified a career in public service and community empowerment. She prides herself as a lifelong learner and has demonstrated skills in coalition and community leadership. With focus on behavioral health, Abby oversees and empowers the coordination of harm reduction program activities and advocates for reducing the burden of health inequities and disparities. Lindsay received her Master of Public Health from the University of Wisconsin-Milwaukee and is a public health specialist in the Greenfield Health Department. She works in various areas of local public health, including community health planning, health education, and grant coordination. In this role, she has developed a passion for behavioral health education and programming, including harm reduction and overdose fatality review efforts. She strives to support, create, and champion behavioral health programming that destigmatizes mental health conditions, uplifts the voices of individuals with lived experience, and decreases harm and fatalities associated with opioid misuse in her community. Abby and Lindsay, thank you so much for the important work that you're doing, and we're looking forward to hearing from you.
All right. Hi, I am very excited to talk about the history of the Greenfield, the Healthiest Greenfield Coalition, and kind of how we came about and ended up with one of our most valuable resources in Greenfield, safegreenfield.com. So a little history behind the Healthiest Greenfield Coalition. This is an effort that includes many of our partners across the city and even so much as partners across the county. Currently, our 3 main priority areas include nutrition, physical activity, behavioral health, and then healthy aging across the aging spectrum. So a little bit about behavioral health in specific. We had many different activities, one of which was an opioid fatality group, or an OFR, a team that would meet to review specific opioid-related fatalities in the city of Greenfield in an effort to come up with recommendations on how we can implement more preventative activities and really get to the core of preventing overdose. So one key recommendation that came from the OFR team was to create a virtual resource where individuals can go to have education on accessing resources such as mental health resources, suicide prevention, opioid treatment, and other sort of referrals. That resource has grown into be an invaluable part of our community and the prevention efforts that we have today. So I'll let Lindsay Foose talk a little bit more about safegreenfield.com.
Thank you so much, Abby. Yes, over the past 2.5 years, we have taken community recommendations, strategic planning efforts, and community listening sessions to create Safe Greenfield. Safe Greenfield started out, as Abby mentioned, as a place to gather resources, be able to provide a multitude of different needs and resources. And it kind of became more than that. Over the last probably year, Safe Greenfield has kind of grown into its own entity. We are now not so much a website, but a health collaborative. This has expanded beyond our city limits, and we work with community organizations that support treatment and peer support for substance use disorders. We work with other nonprofit organizations that work in mental health, homelessness, various other areas of health, and then as well as our strong relationships here with our city leadership and our departments, which include our fire department, our case manager, the city of Greenfield entities go even beyond that. Our library has been a huge support to us, along with a ton of other people in our community. And so really it kind of formed into this health collaborative on its own. And our team is so dedicated to trying innovative ways to prevent harm and death from opioid overdoses in our community. We have implemented several projects over the last couple of years. Most recently, we have created a pilot program. We are the first in Milwaukee County, and we were able to establish a Narcan vending machine. This project has come from years of work. We started out by expanding our Narcan Direct program. As soon as we were able, we jumped on board to become a fentanyl test strip direct site. So we're able to provide free Narcan and fentanyl test strips directly to our community. And then from that point on, we were able to expand services further to do Narcan Leave Behind. So through this program, we work with our EMS system, and when they are called out to a suspected overdose, Narcan and fentanyl test strips are left with the person who the call was made for, or for a family member or friend at the scene. And then all of these opportunities, all of this work, kind of figuring out, the tweaks that we needed to make, it all led to this most recent pilot. And this project has truly encompassed what Safe Greenfield is. And what we're trying to do is save lives without judgment, without shame. One of the things that we always say is that you can't support somebody if they're not here with us anymore. Safe Greenfield has really been that hub for how you can get involved, including information on our Narcan vending machine pilot program, accessing Narcan and fentanyl test strips in our community, how to be an ally and support organizations that are very active in the recovery community, and different groups that you can attend, whether you're a family member, a friend, and also like for the general public to learn more about what an overdose is, what is going on, especially now with how much things have changed, how parents can talk to their kids about substance use and alcohol and underage drinking. And so, as Abby said, we kind of started with this little coalition, and it came out of so many ideas, so much community building. And when we realized that there was so much potential and so much passion for the work that we were doing, that's when we formed Safe Greenfield. And all of this work has come from so many years of communication, conversations, really getting at that cross-sector collaboration and how public health can really support all different areas of the healthcare field and bring all of those partners to the table to make some of these changes. And we are so incredibly lucky to have the team that we do and for the work that we've been able to accomplish.
I think that you said some really important key things, some really important pieces to the success of Safe Greenfield. We have spent a lot of time and a lot of effort to listen to the community, and this was, one of our key drivers. The city case manager, Maggie Sutton, we are very lucky to have a citywide case manager. She works out of our fire department, and it speaks to the value of partnership in the city of Greenfield. But with her being available citywide, she can work in different areas, and she can really help us to engage with people of different groups and help make connections. Lindsay, I know you had mentioned we engage our peer specialists in conversations, the case manager, different partners. That listening has been so important in the work, to inform the work that we do. It's, being in public health, we have these great ideas, but sometimes the ideas aren't necessarily what the community is in need of or truly wants to see.
And I think too that a lot of our partnerships have led to partnerships. There are so many organizations that we aren't necessarily aware of or aren't in our specific jurisdiction and are maybe just outside of, the city of Greenfield, but they can work with our community members. They're close to our community members' homes, and those relationships are not possible without those connectors. And I know that we often call Maggie the bridge. That's kind of her nickname in Greenfield, because our city case manager, our EMS system, some of our area organizations, they know what their members need. They are out on the ground. They are seeing everything that's going on. They're talking directly to the community. And while we don't always have that opportunity to be directly in front of somebody and able to speak to them, what we're able to do is, everybody's able to bring that back to the table and say, hey, like, we see that this trend is going on, or we've gotten reports that this is happening. And we're able to put our heads together and say, okay, we're recognizing that this is a problem or this is a need. You guys have individuals that we can speak to, or other organizations that can support us in this effort. And from here, how do we want to work together to meet this goal, whatever it might be, to really ensure that what our community is saying that they need is being accomplished? Because at the end of the day, we can look at data, we can look at trends, we can look at reports, but there's something in public health that is so humanizing that I absolutely love about this work. And with our case management and our EMS system, all of these partnerships really bring the humanity to our community and to the overdose crisis that we are facing. And it really provides us the opportunity to recognize that when we're doing Narcan training, when we're working with, larger community events, that we know that the work that we're doing, there are people behind those stories. There are families behind those stories.
That's spot on. And to really wrap up our conversation, I want to express our gratitude and thanks for organizations like Alliance for Wisconsin Youth, and the community advocates, as well as I know the group as MixApp, but now Rise Drug Free MKE. That partnership has been so helpful to advance this work because we receive not only support, feedback, but also funding that has really helped to drive the work in the website, fund the Narcan vending machine work, help us to support many of those education campaigns, print materials. Those are the things that we need. And although this has been an effort over a couple of years, as Lindsay had mentioned, all of those small efforts have been steps forward to a really great thing in our community. So I want to particularly call out and thank those organizations that have helped to support us.
Thank you, Abby and Lindsay. It's so valuable to see how we can tie together resources and services at the local level. And it's exciting to see health departments like yours that are on the cutting edge of new practices. Thank you for your work and for sharing your time with us today. Our final guest speaker today, before moving on to the virtual reality demonstration, is Tahira Malik. Tahira founded Samad's House in 2019. Samad's House serves as a sober living home for women recovering from opioid addiction and substance use disorder. Samad's House clients are mainly women who have recently been released from the Wisconsin Department of Corrections, Rogers Memorial Hospital, or a residential treatment center. Samad's House provides a comprehensive menu of life skills, counseling, and legal support services to rebuild the mind, body, and spirit of women who have lived with addiction for multiple years. They impart necessary tools for their clientele to manage sobriety, restore families, and comfortably reacclimate into society. As Milwaukee overdose rates escalated, Samad's House expanded their menu of services to include life-saving harm reduction initiatives, using their network as trainers for the entire community.
Good morning. I'd like to thank you guys for coming here today. And I begin by thanking PATCA, Walmart, and Rayco for bringing this opportunity for us to bring awareness about Samad's House. Samad's House is a sober living home for women in Milwaukee County. Our mission is to create an environment that provides individuals who have a history of substance abuse with tools necessary to manage sobriety, restore families, and comfortably reacclimate into society. Unpacking that, what Samad's House does is help women who've come out of residential facilities to recover from substance misuse. We provide them with programming and a rigid schedule to rebuild their lives after addiction. Our main focus is to bring hope to people to understand that addiction is not a life sentence. It doesn't have to be. As we began to grow, Samad's House decided we want to go back out into the community and pay it forward. And we do that by having a harm reduction agency. Our harm reduction agency goes out into the community and to bring awareness to the perils of substance misuse, bringing awareness to what a drug overdose looks like and how to prevent it from becoming fatal. We do that by training the community on how to effectively use Naloxone and how to effectively use the fentanyl testing strips. Samad's House has 4 main prevention goals. The first goal, we go out to bring greater awareness and educate the community by bringing proactive coping solutions to combat the fatal drug overdose. Our second goal is to create and develop pivotal outreach strategies using the Milwaukee County dashboard to find which zip codes has the highest number of fatal and non-fatal drug overdoses. The third goal we produce multiple strategic events and partnerships. We partner with Milwaukee County Behavioral Health, the City of Milwaukee Health Department, and Vital Strategies, and a number of other community agencies who have the similar goal of preventing fatal drug overdose. Our last goal is that we create and develop a survivors coalition. We wanted to bring support to people and children who may have lost a parent, an auntie, or a loved one to drug overdose. So Samad's House mission overall is to, number one, have a safe place for women and children to live in recovery, but number two, come out into the community and bring awareness of the perils of substance misuse. Thank you.
Thank you, Tahira. It's impressive to see how in just a handful of years, you've truly started a movement that is reshaping lives and impacting the entire community. We know your work is invaluable to the people you reach, and we're wishing you continued success. Thank you for being here with us today. We'd like to thank all of our speakers here today. Each one of you are doing so much to raise awareness and expand services in this challenging environment and provide services to your community. And now we will view the virtual reality simulation portion of this event. Walmart has invested in training their associates, which includes the use of virtual reality. The virtual reality program was developed as a tool for training to build skills in unique training simulations that are hard to replicate in a classroom setting, such as Black Friday trainings and simulations. This technology led to the development of a non-retail training such as the VR that we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency? Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you so much to the Walmart team for developing this powerful tool. We are so excited to work with you to connect this to the community. And again, thank you to all of the speakers here today who have taken time to be part of this event. We want to extend our thanks to all the speakers and to participants. We truly appreciate your time and insight. Please reach out to us at CADCA anytime with more suggestions and questions. My name is Reiko Mendoza, and you can reach me or any of my team at rmendoza@cadca.org. And look for us to be reaching out to you as well to discuss this more and get your tremendous, important feedback. Again, thank you to the Walmart team for developing this powerful tool. And finally, thank you so much to our friends at Rise Drug Free Milwaukee and community advocates, our co-hosts today, and our wonderful friends. We've added everyone's websites to the chat box. Please visit them and learn more about the amazing work they're doing. We're now through the hour and we will conclude the webinar. Again, thank you all for attending and for all of the work you do every day in your communities. I hope you have a great rest of the week.